Hi, I'm Aaron L. Farrell. Thank you for tuning in to this special half-an-hour program that will focus on healthcare for you, your family, and why you should sign up at HealthCare.gov. Let me share some facts with you. Did you know that nearly half of all Americans use prescription drugs? If you were admitted to the hospital for treatment for asthma, it will cost you over $12,000. What about a torn ACL? Over $9,000. And for many people today who are being treated for diabetes, it will cost an uninsured patient nearly $25,000 if they were admitted to the hospital. Here are some more facts. The typical prenatal care and a hospital birth together cost $9,562 for someone without insurance. More than 1 in 4 young adults in America does not have health care coverage. The recent Enroll America survey also found that 81% of uninsured adults do not have health care. In the year 2000, by one estimate, 5.2 preventable deaths a day occurred among adults aged 25 to 34 due solely to the lack of health care coverage. And one last fact, about 15% of young Americans has a chronic condition. Nearly 1 in 10 report having a mental health condition. Young adults need health care, and that means they need insurance. In the city of Detroit, Mayor Mike Duggan has declared March as Enrollment for the Affordable Care Act month. That means you can sign up at HealthCare.gov and purchase affordable health care for you and your family. Now, many of you have questions about the Affordable Care Act. In the next few minutes, we will address your questions and give you details on how you can sign up. We had a chance to talk to one young lady who found out while having health care coverage was not only needed, but it saved her financially. Here is her story.
I'm a volleyball coach. I'm an actress. I also do marketing consulting. I'm pursuing my own business. It's a manufacturing company. And so far, that's it for now. With my income fluctuating month to month, I knew I couldn't afford health insurance. So I just never thought about getting it. I said, well, as long as I eat healthy, I work out and everything, I'll be okay, I'll make it. My father was, being a father, being protective. He said, Lanika, it's time for you to get insured. Once you look into, this new marketplace. And I'm like, all right, Dad, I'll do it. But I'm like, I'm healthy. I don't need health insurance. But after him, being persistent and Lanika, you really need to look into this. Have you looked into it yet? I said, okay, let me just get online, check this out, just to get him off my back, And in October, it was unsuccessful for me. So I'm like, okay, I tried. At least now I can say I tried. And then, so I continued living a healthy lifestyle, but it wasn't until December I got into a collision playing volleyball with my teammate, and I suffered a mild concussion. Being a volleyball coach, I know what signs and symptoms to look for in a concussion, and I knew immediately after the collision that a lot of those signs were checking off for me. Just the wooziness and everything, and dizziness, and so I said, okay, I know the next step is to seek medical attention. And I didn't really want to do it, and the only reason why I didn't want to is because of me being uninsured, and I didn't want to face a high medical bill of being uninsured. I was like, oh crap, I'm like, oh, what am I gonna do? I already know my finances aren't stable, and I know that being uninsured, going to the emergency room, that I'm probably looking at like $1,000 bill, possibly. And I felt horrible, really. Like I don't need another debt to add on to this massive pile of debt that I have, student loans and everything else. And so I just really felt horrible. I felt, I didn't feel protected. I was very vulnerable, and I'm like, I really felt like I gambled with my health. I'm like, just not being insured, and it was like a wake-up call for me. I am a volleyball coach. I was uninsured. It wasn't until I suffered a mild concussion that I said, yeah, I think I better look into this. I went on to the health insurance marketplace. I signed up. It was very simple. I was able to find one that's under $100 a month, and it has dental. It can fit with whatever budget I have month to month. I'm very elated about it. Everybody should be covered.
Go to the health insurance marketplace at HealthCare.gov.
I'm really passionate about music, writing it, playing it, performing it, touring around. As a songwriter, all different kinds of things inspire you. Sometimes it's the girl you are currently into or the last one who broke your heart. I really love a great song. That's everything.
If I prove false to you, that would...
Some of the biggest challenges to being an independent singer-songwriter are, well, just the constant financial uncertainty. I've always been healthy. It would take one trip to the emergency room to really derail me financially, I'm sure. I have a friend in Seattle where I used to live who's a lot more sensible than me. She called me one day and said, we're going to go to the website and we're going to get you health insurance. As an artist, I don't make a lot of money, and so I'm really surprised and grateful. My insurance has a $500 deductible. I pay $17.34 a month. Boom. It's actually a peace of mind that I have that I didn't know that I didn't have. Having health insurance means I can still continue to fish for the next song that's going to mean something to me and other people, and that it's going to be okay if something happens along the way. It's a good feeling, actually.
Gotta do what you gotta do.
My name is Ispa. I go to UT Austin, and about 4 years ago I went to the doctor. I went with a symptom of fatigue. I was just tired all the time. I get a full blood panel, everything comes out normal. After that, I was without insurance for a few years. I got diagnosed with lupus in the summer of 2009. I lost 20 pounds in about 2 months. I wasn't eating, my hair was just falling out constantly. There were pains in my joints. 3 or 4 months later, my dad got another job, and the company that he was working for now was going to provide coverage for our family. Based on my condition of lupus, I was denied coverage. So I was without coverage with my condition for about a year. It was a very stressful time and a very frustrating time because I knew I needed care and I could not get it. So right now I'm covered, and I will be until I'm 26 because of the Affordable Care Act. This has directly had an impact on my life. I don't have to worry about not being able to see a specialist, not being able to get the medication that I need. When I turn 26 and trying to get coverage for myself, I'll be certain that I will not get rejected for my pre-existing condition. I think that's a very, very comforting fact.
When you look at the Affordable Care Act, first of all, I want to state that it's known by many names. And I think that that's important for the community to understand that. It's known as Obamacare, and I think that that is important that people know that when we say Obamacare, we're really talking about the Affordable Care Act. And when you look at the Affordable Care Act, the main purpose of it is to make sure that people have access to health care, that they have affordable access to health care, and that they actually have health coverage. And that's really important for our community. When you look at our community and you look at the incidence of chronic disease, when you look at illness, when you look at the need for better nutrition, and just being able to take good care of yourself. So that's why it's really critical. When we look at insurance that you can now purchase on the marketplace, and when we look at the Affordable Care Act, basically there's a category that's called essential health benefits. So, and essential health benefits cover everything from prescription drugs, ambulatory services, so if you need to be transported by an actual ambulance. It covers preventive care and wellness services such as immunizations. It covers rehabilitation and services such as that. So it covers quite a bit array of health services that you would expect, but that in the past was not covered by some of the plans. And that's the great thing when you really look at the Affordable Care Act, is that now everybody has an equal playing field, and everybody has a core set of health services that are covered no matter what plan you're on. And that's really key. In addition to that, no one can be denied for a pre-existing health condition. I mean, that's the other thing that's really good about this new law and about being able to purchase coverage now. You cannot be denied, nor can your rates go up due to an actual health condition. Health plans can't drop you if you're sick. So all of those things in the past that maybe caused people to think that I'll never be able to get health coverage, or that caused them to be weary about the cost of care, a lot of those things are really no longer an issue when you look at the Affordable Care Act.
Well, there's an enormous number of people who are uninsured, and it can be for a variety of reasons. Sometimes it's just temporary, people have lost their jobs. Sometimes it's long-term because they are homeless, for example, or they just have never been employed, or they're in a job situation that does not give them insurance. You see nearly 100,000 people in the emergency department every year at our single hospital, but of course across all of Metro Detroit there are literally probably a million visits a year in the emergency departments. And so the emergency visit business is very, very busy, and that's partly because people don't have good access to affordable care. I think one of the biggest reasons that people come to the emergency department rather than their primary care doctor or a primary care doctor if they don't have one is because the emergency department is more convenient. We're open 24/7, 365, and there's a sense that people can just walk in and essentially get care. It's like a fast food society. The problem with that is there are so many emergencies that have to take precedent. So when somebody is shot in the chest, when somebody's having a heart attack, I need to take care of that person before I need to take care of the person that has an earache or has had a cough for a week. And so the other person is going to have to wait. And that means even though they come in thinking they're going to get care right away, there's still going to be long delays. And the more people that come in for that kind of emergency care that's not really necessary in an emergency setting, the longer the delays end up being. And that's why we do try and encourage people, if they can, to go to their primary care doctors. It's not necessarily a cost difference. That is, I don't think people necessarily look at the emergency department as free care. They're going to get a bill. That's a simple fact. There are very few programs or very few insurance programs that completely cover emergency care without some kind of copay or deductible. That is a part that you would be responsible for yourself. Doctor's offices, that again is a less expensive thing. So I would choose a doctor's office if I thought the problem could be handled there. The Affordable Care Act is an awesome opportunity for everyone now because there are so many things that are built in. That is, there's preventative health care that's built in. There's vaccinations that are built in. And by built in, I mean literally free, no charge. So if you go to your doctor for a preventative health visit, they give you vaccinations, they check your cholesterol, they check your blood pressure, they do diabetes screenings. When you're the right age, they do a mammogram if you're a woman. When you're the right age, they do a colonoscopy looking for colon cancer. All of those things are free, truly free. You pay nothing. There is no deductible. There is no copay. And that's a remarkable thing. And it's an important thing that people realize. Healthcare is now changing from the treatment of disease, of unwellness, to trying to avoid disease, to try to make people better so they don't end up in the hospital, so they don't end up taking care of problems. We look for problems before they occur. So if we find someone with mild high blood pressure, we can treat it before it causes kidney failure. We can treat early mild blood sugar problems, diabetes, before it becomes kidney failure, heart attack, stroke, major killers of people in Detroit. So these are all important initiatives that are baked into the legislation. So the Affordable Care Act is a wonderful thing. The one thing that people need to do, one thing, they need to sign up for it. If you don't sign up for it and you don't get or take advantage of it, it's all for nothing. It's not going to happen magically. It doesn't happen without your participation. You have to come in, you have to sign up, you have to give your information to get the card, to get whatever numbers that they're giving, and get insured under the Affordable Care Act. Now that may mean choosing an insurer, that may mean choosing a plan, but it's going to mean that you now have insurance that will cover emergencies, that will cover visits for sick care if you have problems, but most importantly, free well care, immunizations, screenings for disease. All of those things are free, but you cannot get them if you did not sign up for the Affordable Care Act.
I do not have health insurance, and it's because I cannot afford it. I'm Malik, I'm 23, I live in Philadelphia. I work in the restaurant industry as a bartender and server. Yeah, I've had incidents where I would have liked to have insurance. I hurt my foot pretty bad, and I personally thought it was a fracture. Unfortunately, I can't afford to not go to work and not walk on it, so I just kind of struggled through it. But if I did have insurance, I would have gone to make sure that it wasn't worse than what I assumed it was. Without insurance, a serious accident would pretty much turn my life upside down. It would probably set me back for life. I'm young, and I need health insurance. In my opinion, Marketplace is definitely needed for young people, and I'm gonna do what I should do, which is go on the Marketplace and have a look at it on October 1st and see what my options are. Having it all right there in front of you, on a computer is definitely gonna be easy for young people. I feel like the Marketplace will help me achieve my goals. It'll just be a load off my shoulders. I will definitely be enrolling in the Marketplace as soon as it's up and running. I'm Malik, and I'm looking forward to getting covered.
I'm currently a business administration major, and I work part-time on the weekends, and I also do volunteer work. Any chance or opportunity I have to help out or to give back, I'll take it. Walking around without healthcare insurance was a horrible experience for me. I've been turned away from doctors because I did not have coverage that I needed. I hurt myself playing soccer. They did a CAT scan, and they told me to take some Advil and then go home. The total bill amount was $3,000. Signing up was a total big deal for me. My plan is definitely affordable. Young people just like me can find options that are available and affordable for them as well. Health insurance is extremely important. We do not know what can happen to us in life. It's better to be covered so that you can know that there is a backup plan, you have options, and you don't have to worry.
First of all, you're going to really need to look at your situation, and it's one thing that, in terms of what I'm telling you today, and one thing that you will constantly hear from me is that really look at your particular situation. This is one of the confusing points in terms of how this all works, because when you look at the buying coverage on the Marketplace and when you look at the Affordable Care Act, there's a couple of factors to consider. First of all, you have to look at what your current health situation is. You have to look at what your current health needs are. You have to look at whether or not you take prescriptions, different things such as that. So you have to need to think about that before you go out and select a plan. A lot of people will go out and select a plan just based on that monthly premium, and you have to remember that there's more that you may be paying than that monthly premium. There's co-insurance amounts, as well as co-pays and deductibles. And it's important that you work with somebody to really understand what those mean. And when you look at certain situations like deductibles and actual co-insurance amounts, those amounts have to be paid for some health plans before they would even begin to cover your services. And so, that's important to actually keep in mind. But you will need to have the names, and you'll need to have the Social Security numbers for everyone who you will be applying or you'll be assisting, or everybody who in your household that actually need coverage. You will need that information. You also need to think about how much you're making this year, because when you look at eligibility in the marketplace and how much of a subsidy you can get is based on your estimated annual income for 2014. When you look at in terms of how a rate is determined on the marketplace, there's 5 rating factors. So the first rating factor is location, so that's geographic area, so it depends on where you live. The cost of living is different in different areas, and so that's factored in. Another one is age. An older person will pay as much as 3 times more than what a younger person will in order to be able to have health coverage. Another one is tobacco use. So if you are a smoker, you're more likely to pay about 50% more than a person who does not smoke. The other category is, once again, whether or not you're an individual or whether you're a family. Obviously, if you're a family, you'll be paying a little more, but in either situation, based on where your income is, there are subsidies available for you. And then the last one is really dependent upon the type of plan you choose and that plan category. So there are 5 different plan categories. You have Platinum, which is top of the line healthcare coverage. So with Platinum coverage, you have lower out-of-pocket cost in terms of with your deductibles and copays, but your premium, your actually monthly premium is higher. So you have anywhere ranging from Platinum, you have Gold, Silver, Bronze, and then you can just purchase a catastrophic plan. Catastrophic plan basically means that if you just need to go to a doctor when it's an emergency, that will cover your the actual emergency care, that will cover you seeing the actual doctor, anything associated with that.
What people need to start to look at is what their out-of-pocket cost is, what they need to pay, what they're going to get a bill for that they are responsible for. And when your personal physician sees you, that out-of-pocket cost is significantly less than the emergency department. And the simple reason is the emergency department is a more expensive place to get care. Keeping the lights on, keeping lots of nurses around, keeping lots of doctors around, even though we may be busy all the time doing other things and we're there, it's still a very expensive endeavor. The doctor's office has resources, but they plan appointments. They know what resources they need, so they can actually control their costs much more effectively. Plus, the type of care that's given is very different. When you come to the emergency department with something that is very minor that could be handled in a less expensive setting, you're basically wasting your own money, in my opinion, because you're paying more for something that you don't really need.
First, you have to take a look at what your actual situation is, because really when you look at the Affordable Care Act, there is a wide gamut of income ranges, and it is based on whether or not, once again, you're going to be an individual or a family and where you are in terms of the actual federal poverty line. So when you look at the federal poverty line, you could be 400%, up to 400% of that federal poverty line, and you will be eligible for subsidies. Depending upon the lower income you make, the higher your actual subsidies would be. And then in certain situations, you would get advanced tax credits, which means that as soon as you apply and you go through a process of determining your eligibility, there's automatically credits that are going to be given to you. So there's been situations where people are paying as little as, below $100 a month or below $50 a month. That, once again, but it depends on how much you make, and it depends on how many people are going to be covered. Whether or not you're an individual or a family, and that's important to know.
My bill's only $97 a month. That's how much my premium is. The plan that I chose is well worth over $300 per month. It includes dental. I'm just so excited about it because now I get to have my old doctors that I have years ago when I was on my parents' health insurance, long time ago. Now I can have them back, and I feel just great and secure, and I know that it doesn't cost that much per month to have this confidence and to be covered.
I like to think of myself as a really passionate and driven bartender, and I think that's probably what sets me apart from a lot of other bartenders. Hours are rough, there's a lot of physical labor, there's a lot of math and memorization. Since I've been an adult, I have not had health insurance. The hospitality industry is infamous for individuals not really having the resources in place to get health insurance. So when I finally was able to purchase some healthcare, I actually went online to the marketplace, and that's where I found a plan that really fit me. There were definitely a large variety of plans out there that I think anyone could probably find what they were looking for. I was able to receive a tax credit, and so I'm very well covered for $15 a month. So it's pretty awesome. It's intelligent to take care of yourself. You know, I think a lot of people think that there's nothing for me or there's nothing that I can afford, and those people haven't even looked. But now I just have a certain confidence that, you know, no matter what happens, I'm going to be covered, I'm going to be insured.
There's a lot of help out there for you. First of all, you know, if you have a certain health carrier mind like HAP, you know, we're here to help you. You know, you can call us at 855-WITH-HAP, or you can visit us online at choosehap.org. We have service centers available. But in addition to that, you can go through an actual licensed insurance agent that can help you. But most importantly, we have people in the community. It may be people you know that have become certified application counselors. They could sit down with you, as well as navigators. Our state has 4 navigator organizations, and it's their job to make sure that they walk you through in terms of how to apply for coverage, as well as help you determine the type of coverage you're actually eligible for. You can go to Enrollment.com, and then you'll see tons of resources there, as well as when you go out to HealthCare.gov. We hope that you don't miss the March 31st deadline. We want everybody to get signed up. If you sign up by March 15th, then you will be eligible for coverage beginning on April 1st. If you sign up between March 15th and between March 31st, you'll be eligible for coverage on May 1st. Now, there are a couple of situations that if you have what we call a qualifying event, which means that if there's a birth of a child, if you get divorced, if you get married, in those type of situations, you can still go out and apply throughout the year. But if you don't have a qualifying event, you have to apply by March 31st in order to be able to get health coverage for this year. You won't be able to apply again, not until it's going to be from November 15th until January 15th. So it'll be November 15th of 2014 until January 15th of 2015 when you'll be able to apply for coverage that will be effective in 2015. For most people, though, I also want you to keep in mind that you will face, or you may face, a tax penalty. For 2014, it'll be $95 or 1% of what that annual household income is. For 2015, it goes to $325, and then in 2016, it'll be $695. And so that's something that you can avoid by making sure that you sign up for coverage as soon as possible. And once again, there's a lot of resources out here. I mean, just for the fact that Mayor Duggan is making, you know, city offices available, and he has this campaign going on right now to make sure that the community knows there's help for you.
I just advise just young adults. I know how it was. You feel like you are young and you're healthy, and there's no, what's the point of having health insurance? But you never know. You never know what's gonna happen in your day. You never know what tomorrow may bring. No matter how healthy you are. I didn't think that just by me playing volleyball, a sport that I love, that I'll have an accident, you know, and it was like I'm one medical disaster away from a financial disaster. And young adults need to know that tomorrow isn't promised, nor the rest of the day, but we don't know what could happen in that day. And we just don't live on the edge. Don't live like, you know, you're one disaster away from a financial disaster. So I highly encourage everybody to get insured, not only young adults, but everybody needs to be insured.
There you have it. Now you know why you need health care coverage for you and your family. It is much too important to let this opportunity pass you by. Make sure you visit HealthCare.gov to sign up for your family and for yourself. Health care coverage is needed, and it will save not only your family, but your life. Thank you for tuning in.
A lot of people my age seem to think that, we're invincible, that we can get by without health insurance.
If you actually go to the website and look at your options, that you'll realize how within reach healthcare can actually be.
I want that plan. Okay, done, purchased.
I can get a simple, cheap, affordable plan.
So I'm very well covered for $15 a month, so it's pretty awesome.
I'm actually qualifying for a tax credit.
I pay $17.34 a month. Boom.
Having health insurance means peace of mind.
It's better to be covered. There is a backup plan. You have options and you don't have to worry.
I got covered.
I got covered.
I got covered.